My name is Austin from the Alterra Health team, and we appreciate you taking time out of your schedule today to join us. For these webinars, we typically expect between 40 and 50 providers. And so we're just going to hold tight and go over a little bit of housekeeping for the first minute or so to make sure everyone has a chance to join. Today, we are talking about obesity medicine practices, how to start practices, how to provide better care, better outcomes for patients, and how to grow those practices in ways that are sustainable and profitable. And so that is our focus for today. We have a 30-minute session on the books. And so if you're on the East Coast, we will be wrapped up by 7:30 p.m. If you're on the West Coast like we are, that's 4:30 p.m. Pacific. And we like to make these sessions as interactive as we possibly can. And so if you have questions, please write in Demio here. There's a little chat window so you can ask questions, participate. If you've seen something in clinic that you would like to share, please, mention it again in the chat and we'll be sure to tell it to everyone on the call here. If you have a question that you would rather not ask directly in the session, feel free to email us after or even right now if you'd like. Our email addresses, both my address and Whitney's address, will be listed throughout the presentation, but you'll see mine here. It's austin@alterrahealth.com with 2 R's. And in terms of next steps, we take a very proactive approach here at Alterra Health. And so as soon as this session wraps up, you will get an email with a recording of the session. So if you want to share it with your colleagues, other providers, friends, please feel free to pass that link along. And then at the very top of that email is going to be a big orange button where you can schedule a call with us and we can walk through what this looks like for your individual practice. We can answer your questions, and we do that free of charge for providers. And we find that providers and teams get a lot of value out of these sessions. It's absolutely no strings attached, no pressure whatsoever. We talk to providers every single day of the week in the obesity medicine space. And so perhaps we can share some insights that might be valuable to you and what you're looking to build as well. So click the orange button in the email you get after this call, and we would love to speak with you afterwards. So just to go over a little bit of background information now, who am I? Who is Whitney, also on the call here? So my name is Austin. As I said, I'm a co-founder of Alterra Health. And before founding this company, I ran a marketing agency for 10 years, and we specialized in helping bariatric and medical weight loss clinics and brands. And so that's my background. A lot of the insights that you'll see around clinic growth, clinic marketing come from that experience. And that's actually where Whitney and I met, is in the bariatric space. And so, Whitney, please give us a little bit of background information from your end as well.
Hey everyone, I'm happy to be here. I'm glad you guys are here. Just a little bit about myself. I am a dietitian. I'm also co-founder of Alterra Health. My journey began in bariatrics, or the weight loss industry, or weight loss surgery industry. There I learned tons of information about how to counsel patients, what they needed, what they didn't need. So from there, I fell in love with developing programming for clinics so that patients can better their lifestyle in between clinic appointments. Better yet, saving time on the clinic's end and really helping them support their patients by providing adequate and fully supportive, holistic care in between those clinic visits. So that's my passion, and that's who I am.
Thank you, Whitney. And just so you guys know how we run these presentations, so Whitney and I kind of tag team as we go throughout. And I was counting earlier today, I think this is our 12th version of this presentation that we've given. And so I'll go through kind of the beginning and middle part of the presentation, and then Whitney will take over from there and we'll wrap up at the end. I saw some people just trickle in here. So if you have questions, we want to make this interactive, please. There's a chat window within Demio, the webinar software here. Please write in. We would love to hear from you. So today's session, we are going to cover 3 main questions. And you'll see that the presentation is broken up into sections numbered 1, 2, 3. So we're very clearly going to go through and answer these questions. The first being, what does the current landscape look like for medical weight loss? And then we're going to go over, okay, within that landscape, how can you compete? What can you do to set your clinic apart from the rest? And then lastly, Whitney's going to go over, we talk to hundreds of patients each week. And so she's going to go over what we're hearing from patients and actionable steps that you can take based on that feedback and apply to your practice tomorrow. So those are the three questions that we are going to be going over here. And to provide a little visual context to the presentation, so we're going to start broad, as I said, with just what does the landscape look like. Then we're going to zoom in a little bit and talk competitive advantage, how to differentiate your practice, marketing, things of that nature. And then we're going to leave you with actionable steps, a list of things that patients are looking for that you can take to your team and apply into your practice tomorrow. And so if that's a little nugget to stick around at the end, that is what we're going to end with, is those growth strategies. So before we dive in, I just want to caveat a little bit that you might be thinking, okay, well, how is this relevant to me? And as I said, we've done this 12 times at this point, and we've built this presentation to make sure that we provide insights to solopreneurs, providers that, it's just them in their practice, all the way up through clinics with 10, 20 providers. And so we've tried to tailor these insights no matter where you're at, what size practice you have. And as you'll see on this screen, these are some common challenges that pretty much all practices face in this space. And I would say the biggest one is time. And time affects the solopreneurs, the sole providers, all the way up through those big practices that I talked about. Because if you're just starting out, it's just you. And so you're juggling everything yourself, limited time there. And then if you're in a massive practice, you only have 10, max 15 minutes to see patients. You're probably running late all the time. And so you just don't, there's not enough time in the day to do everything you need. And so that is one of the lenses that we're going to look at today, is time. Very quick background on us. So Alterra Health is the leading provider of obesity medicine, education, and support. And we started in medical weight loss, and we've since expanded out. And so now we serve providers that have primary care, direct primary care practices, endocrinology, gynecology, lifestyle medicine. And so we have a lot of experience with just medical weight loss, but we've since expanded into other specialties as well. So here is question number one, section number one of our presentation. What does the current medical weight loss landscape look like? And very simply, it's becoming quite crowded. That's the truth of the matter. I mean, you have med spas, you have telehealth providers, you have family medicine offices that are prescribing medications, you have DPC. And so it is quite crowded. And we're going to talk, the space is in flux with the situation regarding compounded medications, but it is still very competitive. And so when we get into section two, we're going to talk about, in that space, how you can stand out. I put these two screenshots up here. We're all familiar with these companies. I mean, we're talking Roe, Hims, Hers, and I don't put these screenshots up here to talk specifically about the companies themselves. Instead, my point is just to illustrate the type of experience that patients have grown accustomed to and are looking for. So patients want a highly interactive, they want a guided user experience like these companies have and currently are providing. And so the big takeaway from this slide is just user experience, interactivity, guided, programming for patients. And these companies obviously have millions of dollars, but we're going to show you how you can do it in your practice without the type of funding that they have. So this brings us to what we at Alterra Health call our price to patient continuum. And it's a simple graph here that just shows where to compete and what the market looks like. So when you think of the mass market, big major telehealth providers, they're going after a very high number of patients at as low of a price as they can. And so they're trying to achieve economies of scale with as many patients as possible. And so trying to compete as a private practice owner in this, bubble here is very, very tricky, because it's just nearly impossible to compete with the companies that have the level of resources that we're talking here. However, in this space, there leaves a gap where we're talking a higher price point, but with a lower number of patients. And so this is where, as a private practice owner, you need to be focused, is how do you have more white glove, custom, personalized service at a higher price point for a lower number of patients? And so screenshot this. This is a great little visual as you think about what's happening in the market. Very quickly, I just want to mention again, a company like Roe.co, they've raised over $1 billion at this point. And so those telehealth companies are competing on accessibility and speed. And as you'll see in the next slide, we recommend, not competing on those variables and instead choosing other points of differentiation. So I got a little bit ahead of myself here, but now we're entering section number 2, question number 2 of our presentation, which is, okay, we looked at this landscape. We know roughly what's happening. So what do you do as a private practice owner if you currently have a clinic or if you're looking to start one? And I want to just go very quickly to this idea of what are the goals ultimately of an obesity medicine practice? And this is going to lead us into this section. So, number one, obviously, the goal is to provide world-class care to patients, give patients the best outcomes that we possibly can. And so that's goal number one. But at the end of the day, if you're a private practice owner, you're running a business. And so you need to be able to deliver that care in a way that's profitable and sustainable. And so what we're going to talk about in this section is the idea that care actually drives everything else. And so by delivering world-class care to patients, then that helps you grow your practice. And by delivering world-class care, you can grow in a way that's profitable and sustainable. And so we're going to show you all of those levers and how to get there as we proceed. So as I mentioned, it's best to not try and compete on the variables of price, speed, and accessibility, because the major telehealth providers out there, they will quite frankly beat you every day of the week on those variables. But if you're a provider that has decades of experience, lead with that human connection, that expertise, the personal touch, and what we at Alterra Health call the 360-degree patient experience. That is an area that you can compete in and win. It's not a good idea to try and compete on price, speed, and accessibility. So you'll see these 4 check marks here summarizing, the key variables that we recommend competing on in this space. Okay, so now I want to define a little bit. We at Alterra Health talk a lot about this idea of a 360-degree patient experience. And so sometimes people are like, well, what does that even mean? So let's go through what that looks like. And it really comprises 6 different buckets. And so we have medication therapy, provider oversight, and then the lifestyle pillars of nutrition, exercise, mindset and self-care, and community. And so these 6 buckets make up what we call the 360-degree patient experience, which is lifestyle interventions with medication therapy. And if you're a provider on the call, your time and effort is best spent with the top 2 buckets there, medication therapy and provider oversight. Going back to this idea of limited time, limited energy, focus there. And it's in your best interest to partner with another resource for the nutrition, exercise, mindset, and self-care and community. Because again, we talk to providers every day of the week, and they're getting so bogged down answering questions about grocery shopping and protein sources. And it's just not the best use of your time in a busy practice. And so focus on the top 2 buckets. That would be our recommendation. So all of this summarized in this slide basically shows that by delivering this experience to patients, they will then get the outcomes that they're looking for. They will then tell their friends about their practice. They will refer business. And so by focusing first on care, growth follows afterward. And so that's, if there's any key takeaway from this presentation, it's focus on the care, the holistic experience first, and then focus on the growth of your practice. So up until this point, it's all been theoretical, right? Like us just talking, oh, here's what you should do. But now Whitney's going to take over and she's going to tell you literally with quotes what we hear from patients every day, and then how you can implement that into your practice. So Whitney, over to you. Please take it away for the next section.
All right. Let me get to the next slide here. Okay, so we're at number 3 now. So what exactly are patients searching for, and what can providers or you do to deliver this experience in a cost-effective and sustainable way? So this section is going to be more about experience. This is real time, guys. This is things that we constantly provide as a company, and this is something that we hope that you can actually implement into your own practices. But we kind of have to frame this into what has worked in the past, like for patients long term. There are some things like you see right here. So what's worked in the past actually doesn't work now, but there's a theoretical part of this that actually still works, and that's structure. So individuals first saw success with things like Weight Watchers, Jenny Craig, Atkins, Noom, you name the program. These worked because they provide a structured supportive system. However, these specific programs that I'm naming, they don't work because there's a dependence on the system. There's no real life applicability. It's minimal long-term education. So they're learning a lot of things in a short amount of time. They're using some kind of a point system. So again, they can't apply it to real life. It's restrictive for the most part, and it's not sustainable. So that's something you don't want to actually focus on. It's a one-size-fits-all approach. We cannot take that approach with our individuals because everyone is literally different. And there's no lack of there's a lack of focus on root causes. So these are the things we really want to avoid, the reasons why those didn't work long term. But at the same time, keep in mind that they do work in terms of creating a supportive system. I mean, there's been people that have stayed in Weight Watchers for 20 plus years, but it's because they became a part of, number one, a community, and number two, a system that really kept them engaged long term. So this is what we're wanting you guys to kind of have in the back of your minds, or the forefront of your minds, those types of concepts. So optimizing patient outcomes depends on these things. And this is coming from years of patient care and studying my patients and pulling out from that clinic that I worked with, and building their program, what actually worked and what did not. I listened to them. We developed surveys. We did tests. We constantly just went back and forth and pivoted depending on what worked and what didn't. So number one, they want a comprehensive program with multidisciplinary care. So they're not necessarily looking for one doctor that can just do it all, which we kind of see that a lot. And, we totally get that you want your baby to be your baby when you have your practice, but really, they really need those multiple disciplines and collaborative care. So, nutrition needs to be coming from dietitians. Their training, motivation, and recommendations likely needs to be coming from a trainer. And then there's the behavioral aspect of it. So pulling in people from therapy or behavioral health with some type of input there, or even speaking to them one-on-one, but nonetheless, multidisciplinary care. They do need personalized plans. So to develop personalized plans from one person is very difficult. So we want to somewhat empower the patients themselves to develop a personalized plan, but they can't do that without legitimate and adequate education. They need accountability and support, and we'll talk more about accountability in just a moment, what that looks like. They need education and empowerment. So the word empowerment, what I'm using this for here is people cannot feel empowered unless they are knowledgeable. So we don't want our patients to constantly depend on dietitians to hear, what do I eat, or asking doctors smaller questions like what do I eat? It's basically, what do I eat? And if a human being cannot decide what they eat, that's very, very discouraging and intimidating for them. So we want to empower them with adequate education. And then we have data-driven care. So what do the statistics say? What do they need? What's actually helping them? How are they sleeping better? Are they reaching their goals with a level of accountability? So really trying to dive deep and study what works for them versus what doesn't. And then the big part is lifelong maintenance programs. So we meet with a lot of providers who may make it an option to meet with their patients. That's not a very structured program. And, we really, really recommend that there's some type of commitment that you instill in your program, whether that's a 6-month commitment minimum, even up to a year. So even when they get to their weight maintenance, they're going to want a place to stay and be followed up on. So lifelong maintenance programs is extremely important to be able to provide. Next, observations from a decade of clinical experience. So again, we're kind of summing up what I found in the last 10 years and what we implement into our own company. So number one is guidance. They need direction, or clear direction on where to begin and how to progress gradually. They need the education. They require that foundational knowledge. So you have to imagine, I meet with patients on a daily basis, and I'm constantly trying to eliminate their perceptions of what nutrition is, what carbs are bad and what carbs are good, and what even are proteins. And so there's actually a very minimal amount of knowledge, no matter what they're telling us, that we have to help replace those misconceptions with evidence-based facts about nutrition, exercise, and behavior change. Number three, practical tools. So practical, I can't say that word, meaning how to. So believe it or not, they're not very well versed on how to set up a morning routine or how to wind down for bed in order to get better sleep. They really are not used to prioritizing themselves or their time to actually take care of themselves or devote time for planning for themselves. So practical tools like workbooks, worksheets, templates, things that actually guide them into how to do this. This even includes live videos, workshops on how to create balanced meals, how to get started with exercise. So it's not really like they need to be told what to do. It's even how to get started and allow time in their lives for it. Number four, accountability. So this is the biggest part. So some level of consistent support is what they have to have. There are some people who will say they really don't need it. They don't like to be told what to do, but those are usually my patients who end up coming back a couple months later like, oops, never mind, I do. So accountability looks different for everybody. So that's really a conversation that you'll have to have with each individual. It might look like a weekly text that we provide to our patients on a Friday right before the weekend. It could be just a quick reminder of a workshop they've been looking forward to because they signed up for it, but they've forgotten. I mean, life is really busy for these people, and to ask them to attend all this stuff is not really the answer. But in some form or fashion, we have to provide a certain level of options and variety as a source of accountability. Number five, insights gained. So I learned what patients truly needed, what resources they would actually utilize, and which tools that proved to be the most successful in their outcomes. And, it's hard to, I think, focus so much on outcomes when you're trying to be profitable in your business. But honestly, at the end of the day, if you're striving to provide the highest quality care, those outcomes, or I'm sorry, that profitability will come. The better your business, the better the care that you provide, the more holistic experience. And I want to capitalize the word experience there, or really emphasize it. If they're getting a good experience, that in turn is going to give you good word of mouth, 5-star reviews. And I've witnessed it firsthand in the clinic that I came from. It was very lackluster due to a lot of reasons. Not the person I worked for, but it was a stellar team, but it was just all the components were not there. And once we developed a legitimate program, we saw a 200% increase in our patient base. But that was because they felt taken care of and there was a long-term program in place. So I definitely love to be able to pass this experience and these findings on to you guys. So I'm going to kind of go through some of the quotes that we want you all to be able to achieve. And the only reason we get these quotes and 5-star reviews is because of the systematic programming that we put in place. So you want your patients to be able to say, I got my first injection today, so I'm feeling ready for this. Not many people really feel ready after years of weight loss attempts. So they're kind of already discouraged when they're coming on and they're like, oh, I got to do it all over again. But, the moment they hop on the phone with us in our coaching calls and we show them what they're getting, they are floored. They always say, where has this been? I've needed something like this for so many years. So other components you want to keep in mind when you're building an experience, if you are building it on your own, is putting everything in one place. So not having, disjointed sites and them having to go here, go here, go here. That's very loose, and that's going to feel overwhelming and they will quickly become lost. I'm just kind of highlighting the main words here. So structure. So this person loved the structure of the program. The fact that there was structure there, they don't have to guess on where to go, what to do, how to do it. Developing some type of structure as the backbone is very, very high priority. This person liked high protein recipes, but the fact that the recipes were so well organized, so it's not just a big sheet of recipes, they're very well organized into subsets and they know exactly what they're looking for and where to find it. It's so nice to be able to click and follow an exercise. So what I'm pulling from that is the easeability of everything, number one, being in one place, but the fact that they're People don't have to go searching for their own exercise online or ask a trainer, what do I do this week? They can literally go into our workout planners, click on a day, and they followed that entire week. It's already built to have that balance of 2 days of strength training, breath work or lower impact flexibility type exercises, and cardiovascular. So they're actually learning. But just to be able to hop in somewhere, click an exercise, and do it in their living room, that's monumental in terms of them feeling like they can achieve something more. Last two, I've tried it all before. The accountability the program offers is exactly what I need. So offering, some level of accountability in your group. This other person said accountability as well. So just kind of gathering a summary of what those quotes are even coming from and what we hear. Patients are searching for accountability and support with resources to help them stay motivated. So when we're talking about motivation, people are very motivated when they first come into our program. But I'm not fooled. I've seen this many times. They'll come in and they are extremely motivated for the first month, but motivation wanes very quickly. It's really learning how to instill those habits and, taking a systematic approach with everything and keeping them engaged so that they're not falling off track or you're losing track of them. They want programming that is comprehensive, well organized, everything is in one place. They want to feel prepared and confident, and that can only come through the empowerment of providing education and giving them the tools that they need to be confident, how to build their own workouts, how to build a balanced plate, how to cut out processed foods and what are quick grab and go types of things. So realistic, real life guidance. We talked about empowerment and confidence again. So effective programming is not about just weight loss. So I talk about this every day. The more and more we talk about weight, the less motivated they will be. So this is more about, painting a big picture for them. So as many times as you can, we talk about selling the vacation and not the plane ride. What do they want to feel at the end of their journey? Do they want to be able to walk Disney without taking a break, like with their grandchildren? Do they want to be able to sit in an airplane seat without an extender? Do they want to, be able to walk a mile without being completely out of breath? Do they just want to feel strong? So really tapping into what it is that they need that's not even related to weight, that will make things feel so much more important to them and valuable, and not just about the scale. Was that my last slide, Austin? Yes. Okay.
I think that's it. Thanks, Whitney, for going over that. And I just want to go back to this slide, guys, because if there's a slide to screenshot in this presentation, I would recommend taking a picture of this one, because you can take this to your team, your business partner, whoever you work with, or even if it's just you tonight, and brainstorm, okay, comprehensive program. How can I make my program more comprehensive? Accountability, empowerment. And so this is a great summary of exactly what patients are looking for and the key pieces to make sure that you incorporate into your practice and programming. And we're in the final home stretch here. And I just want to mention, all of this lifestyle programming, by all means, providers, we see it every day of the week, can build this themselves. It tends to be very time consuming and rather expensive. For practices that want all of the lifestyle, the 360-degree experience, but don't have the time to do it themselves, we have a plug and play option. We've built it all for you. We can have you up and running in literally 2 days. You can brand, our platform with your practice name at the top. And so if you're looking to add that component, we can help you. If not, please take everything in this presentation back to your practice. And no matter if we work together or not, we really want to help you guys grow. This is just a quick example of what our education and support platform looks like. Again, it can be branded with a clinic logo at the top to make the experience seamless for patients. And we like to close with just stressing this idea that the time is now, because if you don't incorporate this holistic experience into your practice, your competitors will. And it's more important than ever, in this crowded space of obesity medicine, weight loss, wellness, to stand out. And so we really encourage you to take advantage of the opportunity here to set yourselves apart. Final thing here, we post videos every day of the week for free on our YouTube channel. We were talking to a provider the other day who in her waiting room has our YouTube channel up on their TV. So please follow us, subscribe, have your patients follow us, tons of free resources. Also on our Facebook and website, we're constantly posting as much free content as we can because we're here to help. So please be sure to check that out. If you have questions, we would love to speak with you. You can scan the QR code and book a call directly with us. No pressure, no strings attached, but we're happy to answer questions and walk through things specific to your clinic. So with that, we are perfect timing, 30 minutes. Thank you guys so much for joining us today. We really appreciate you taking time out of your Thursday evening or afternoon if you're on the West Coast. Whitney, any final thoughts before we click end?
No, thank you guys for joining. I hope this helps.
Awesome. The recording will be in your inbox in the next 15 minutes, and we look forward to continuing the conversation. Thanks, guys. Have a great day and weekend ahead. Bye-bye.